Namaste, I am Dr. Dheeraj. Today we discuss about the disease called diabetic mellitus, prameha. It's a common disease in India nowadays because India it's become the capital of diabetic. So the question is, what is diabetic? So we all know it's a basic simple explanation is rising of glucose level in the blood, hyperglycemia. The amount of glucose in the blood it's rising. That's the condition. So the next question is why it's happening. The two reasons are there that I will tell you. Before that, I will explain you how the glucose works in our body. We know the glucose is a basic energy source for human body. For each cells in our body need glucose to produce energy. So for that process, the insulin, one hormone produced in our body, the organ called pancreas. In the pancreas, there is a area called beta cells. That cells produce insulin hormone. That hormones, insulin, help the glucose to enter inside the cell. Then only the process that cells can make energy. And after the process, the excess amount of glucose, the insulin converted into glycogen and other fat form that stored in our body. So the role of insulin is very important in glucose metabolism. So there in diabetic, two things are happening to the insulin. First is deficiency of insulin. The sufficient insulin is not produced in pancreas. The reason is autoimmune problem, because autoimmune means our own immunity destruct or destroys our own cells. Just like one country there they having the military, then military attacking that same country, how these things have going, it's very bad. That what happening in autoimmune disease. Here it's happens in pancreas, beta cells. That beta cells destroys and there is no insulin production. So insulin deficiency. So glucose metabolism become very traumatic. So the glucose, we are taking food, so of course in the blood the glucose will be there, so it rises. That we call type 1 diabetic mellitus. That most seeing in children's. Very less only that we see in children's. And in adults also we are seeing that is another condition, LADA we call late autoimmune diabetic in adults. The same thing happens there also, autoimmune problem only, insulin deficiency. And next condition, insulin inefficiency. Production of insulin is there. The pancreas is producing sufficient insulin, but that insulin is not working properly. The cells in that cells in our body resist the insulin. So with the help of insulin only the glucose can enter inside the cell. Insulin resistance. That is type 2 diabetic. That is the most like 95% of diabetic is a type 2 diabetic. The reason is insulin inefficiency. Why the insulin inefficiency happens? The reason is lifestyle. Lifestyle means our food habit, our physical activity is very less nowadays. These are the main reason. Some other reasons are there like our genetics and all. But this main two things plays key role in type 2 diabetic. Insulin is there, but the insulin not work in proper way. Type 2 diabetic. So here nowadays we know this type 1 diabetic there is no option, insulin deficiency, so to take insulin is the option. But in type 2 diabetic, that what I said, 95% of our diabetic patients having this type 2 diabetic, that nowadays we know we can treat and we can without medicines we can manage it. But before, nowadays we believe there is no solution for this. Only solution, you take the medicines and do the things. A lot of complications happens type 2 diabetic. But nowadays we know we can very good management is possible in type 2 diabetic, even without medicine also. You are taking medicine or insulin, whatever it may be. If you are properly, like precisely we have the diet and exercise we're following, we can reverse it. Without medicines we can manage type 2 diabetic, that we know nowadays. So we looking to Ayurveda. The Charaka says in Charaka Samhita there are 20 type of polyuria. Charaka says one among that this Madhumeha. The correlation is possible with the diabetic mellitus. The reasons are same only. There is no physical activities, taking more sweet. It's all the cause of diabetic. That what Charaka says. So the proper monitoring your blood sugar level, there are different tests nowadays available, like C-peptide. Like we can evaluate how much how the pancreas is working, how much insulin producing. This all we use, and we can treat, and we can very effectively treat type 2 diabetic mellitus nowadays.